Hey there, everyone. How you doing today?
Hi.
Hi there, Kurt.
Hey, Bobby.
Which role am I playing today, sir?
You're going to play the point guard and leading center of the league. I'll facilitate today, Bobby.
Okay. Thank you for letting me know.
All right. I see it's 103. Welcome, everyone. Welcome. We got about 60 plus people on the call. We got a pretty interesting and full agenda today. Can everyone hear me okay? If you can't, raise your hand or speak up. Speaking up, why don't we do this? If there is someone on this call by phone only, if you could let us know you're there as a matter of attendance, we would really appreciate that. So, welcome anyone. So, any phone attendants, please identify yourself.
Hi, Kurt. I think three of us, this is Cheryl, three of us have already done that.
All right, wonderful, wonderful. Thank you, Cheryl. Thank you. All right. So welcome, welcome, welcome. All right. I think where we're at is kind of the new meeting poll attendee. Do we have anything else? But I see Jessica, you're going to run the new poll for new attendees.
Yes, let's get that going. Hi, everyone. Jessica Corral here. I'm going to pull up a poll that only those of you who are logged in through the internet will be able to complete. So if you're calling in, which we've collected everyone's numbers, so I don't know why I brought that up. Do the poll if you have not joined us before. If this is your very first time, in this meeting, this helps us identify you both as, as a stakeholder and what category you're in, as well as helping to get you into the attendance document for this month. So if you can't see the poll popping up as a separate window on your screen, go down to your menu at the bottom and click on polls/quizzes, and you should see it there.
Awesome. Awesome. All right. While everyone is doing that, again, welcome. I want to try to keep the ball rolling. I think we're going to have a pretty full meeting today regarding discussion. So with that said, well, let's roll into the open forum, number one. This is our opportunity for anyone, any particular subject you want to talk about regarding stakeholder here and just be heard. The intent is not necessarily to solve the problem here. However,
Ouch.
after a little discussion, let's be sure to decide if we want to add that topic onto a future meeting. But with that said, the floor is open. If you have a question, either raise your hand, put your name in the queue.
Kurt, this is Cheryl Hargett Dorset. I have a topic.
Okay, Cheryl. Anyone else?
Renee.
Hey, Renee, Cheryl, Renee. I see Erin has her hand raised up. All right. So, Cheryl, you're the first to bring up the information. What do you got to share?
So in talking to case management this morning for my son's traumatic brain injury waiver and other individuals, I believe that the state has been informing TRE and case management and FMSs about the nurse assessor's role and protocol. My thought on this is none of us know as consumers what their background training is, because they're going to be dealing in a broad stroke of waivers and Medicaid recipients and participants who have individualized, specialized care, one with medical doctors, therapists, etc., and within case management protocol. I'm concerned about their training and not knowing the knowledge of it, nor do the case managers know the training of these nurse assessors. And the time factor in which Second would be the time factor in which they are starting and when Taligent is immediately replaced by the nurse practitioners. I believe this is state-driven, so in our First Amendment rights of free speech, we have the right to know what their background training is, as it will affect us through various levels of case management, review, timelines, and due processes if there is any hiccup in this new shift and transition. We need to be equipped, we need to be prepared, and we do not need to be thrown into a cookie cutter pattern of individuals through a nurse assessment panel that does not have appropriate background training in various real life, real time situations for consumers.
Okay, Cheryl. Thank you for that. I believe we have got, actually, if you look at our agenda, we have quite a few things we're going to talk about regarding that as kind of the step for moving forward. So I hope we answer a lot of your questions moving forward here, but thank you for bringing that up. And we'll also
My only concern, Kurt, is even our case manager, her response to me this morning was, in their discussion, in the state's discussion with us yesterday, it was not the nurse assessors, it was the state discussing what is being rolled out. They were still vague and not clear, and hoping that there would be an agreeable compliance with the nurse assessors. So that's a little concerning.
Okay, I'll just share. I did see an update through my work that stuff is happening, and maybe it's something we could talk about here in a little bit. Just like okay, I saw your note. Anyone's followed up on the poll? Make sure you wrap it up. All right.
I mean, personally, Kurt, I would love to hear someone from the state address that question.
Okay, would that be?
Kurt, I can take that if you'd like. And thank you. I appreciate your feedback and comments on the nurse assessor process. We do not have this specifically on the agenda to talk about outside of our open questions and answer session. So I believe we may have some time a little bit later to go over it. I will mention there is a lot of information out there on the nurse assessor process. My team just finished up a case management training, one of, I think, 4 or 5 different ones happening this week. So yes, there's information out there. If we'd like to have it on the next agenda, I think that would give us better time to prepare and make sure that we've got the questions answered for you. So that would be my recommendation. We can definitely try to hit the questions in the agenda topic starting at 1:20.
I would agree with that, yeah.
All right, good. Thank you, Aaron. Renee, you had your hand up next before I jump back to Aaron. What did you have going?
Yeah, I just wanted to remind everybody, please tell us who you are verbally. We can't see you over the phone. Thanks.
Oh, thank you very much, Renee. And Aaron, I see you had your hand up. It's back down. Did you still want to talk to that?
Thank you, Kurt. Yes, this is Erin Thatcher. Hi, everyone. Happy PDPPC Day. I wanted to let everyone know about a couple of resources that are available. So number one, there is a website that we've developed here at HCPF, which is discussing the federal impacts to Medicaid. And I'll put the link in the chat, but essentially this is a page available to the public to talk about everything federal funding related and how that may impact our state. And as you all are aware, there's a lot happening right now at very rapid speed. So we are keeping that updated as quickly as we can. And then secondly, there is an annual stakeholder webinar on August 12th from 9 to 11 a.m. It is via Zoom, but you can call in and there's a required registration. So they will also be talking about the federal funding piece at that meeting, as well as some of the other priority projects and things that we are working on at HCPF. And so I will put a link in the chat for the website I described earlier, as well as information about this upcoming webinar. Thank you.
Could you please address the phone number for those of us that don't do internet?
Thank you. I actually don't have the phone number. I can work on getting it for you since there's a registration required, but we will work on that after I post this link. Thank you. I
Thank
appreciate
you.
the feedback.
Hey, Aaron, will that also be sent through the Office of Community Living's emails that John sends out?
Great question, Kurt. I believe it's been on there. If not, I've seen it on social media. I've seen it coming out various sources. So this is the big HICPUF annual meeting, and it's run by Kim Bimsteffer and several of the office directors. So we'll get more information and we'll share it a little bit later in the chat and then verbally for those of you on the phone. Thank you.
All right. Any
Yeah,
other?
not all of us are on social media.
Who is that speaking? I didn't catch that last part there. All right. Any other open forum items? If not, I'd like to kind of keep the ball rolling here. It is 10:13. So we are wrapping up. We do have a little bit more time in open forum if anyone has any other topics.
Renee.
Okay, Renee.
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 That was me. I said not all of us are on social media to find these things.
Okay. Yeah, at some points you're gonna have to do some research on your own as well. I don't know. We don't mail out any mail per se on that. Any other comments?
If you could please just send the links to us on an email or something.
Okay. All right. Hi, safety.
Kurt, this is Cheryl Hargett Dorset. I have a question.
Okay, one more question. That'd be great.
So, with all this rollout of changes, my question would be, has the rule of law changed to accommodate these, or are we still operating in an old rule of law?
I'm not sure what you're referring to regarding old rule of law.
The rule of law federally, the rule of law statewise with regards to the new program designs, are they in compliance to state regulations that we have as consumers complied with even in due process hearings, etc.? You have to know the rule of law, timelines, and guidelines and guardrails within the rule of law to know how to advocate. I want to know if that is staying the same or if those are being changed due to accommodate these new program designs.
Ooh, that's something we definitely need to look into. I believe it does. I mean, from what I've read, everything still is falling in line with law that people have to follow. I am aware that the state has a lot of hoops they have to jump through, especially with the CFC. There's some big benefits to the CFC program. Also regarding some other things that we're going to talk about in a little bit. And I do know that there is a nurse assessors group that's been meeting about every week with the state as well that I think pretty much anyone can join. Again, unfortunately, mostly you have to follow the Office of Community Living or their agendas as posted on the website. So, but by law, they all have to follow the law. There's no two ways about that.
So it is my understanding as of this morning with my son's case manager that the rule of law is still in place as it has always been, but we are, the state, not we, the state is rolling out to consumers a new program design, which is going to require jumping through more hoops and more time. That concerns me, and I would love a state representative to address that.
This is Erin. Thank you. Kurt, thank you for your help. Let me just say this. We do have an agenda we need to stick to because we have an hour dedicated to your questions and that were sent in. I will say that the nurse assessor and community first choice are both legislative actions that the General Assembly approved, and we are mandated as the state agency to implement those programs. If anything, I'd like everyone to know that we are expanding self-direction to a lot of new individuals in the state, and there's a lot going on right now. So that may mean that you may not be familiar with all of the different initiatives. And if that's the case, we're happy to connect with you and try to get some resources to you so that you feel more prepared. But I will also mention, in addition to the authorization by our legislature, we have also gone through the rulemaking process, which is a state mandated process by which we develop regulations that are approved by our medical services board and are listed on the website and via the Secretary of State's office. So the rule of law is not changing. We're trying to increase our benefits and ensure that more people have access. And in order to do that, we do have to make some programmatic changes. Those have not happened overnight. This has been a couple of years in the making. So thank you, co-chairs and attendees.
I appreciate that. Thank you.
Thank you, Aaron. You said it way more eloquently than I could, without a doubt. And I think what Aaron is really saying, they're expanding Medicaid and Medicare coverages throughout the state, trying to make things better, not trying to take things away. So, all right. I think we are ready. Let's jump in. Bobby, do you have anything to add before we jump into the questions and answer session for starting here at item number 4?
I just want everybody to know that as you were talking with Kurt, I was taking notes, and I don't have anything to add at this point.
Okay. Thank you, Bobby. All right. I'm going to leave this. With that said, I'm going to have that kind of go from there to the department and kind of help us out with community first choice. And Aaron, I see you have your hand raised. Are you going to talk about that?
Hey,
No,
Kurt,
yes.
this is Danny Kraus. I'm going to speak to this one today.
Great. Thanks, Danny.
Cool. Well, hi, everyone. I'm Danny Kraus, for those of you who I haven't met. I'm the CDAS Policy Advisor at HICPUF. During last month's planning session, the co-chairs thought it would be a good idea to have a question and answer session for the group because of all the changes that we've been experiencing this year. And so to ensure that we get the important questions answered, we did ask stakeholders to submit questions to us, and we have committed responses to those questions. We understand that since that initial email went out, there have been some policy updates specifically around difficulty of care payments. And so we will also be addressing some of the frequently asked questions that we've been hearing through our stratosphere during the question and answer session. Once we get through these assigned topics, we'll open it up for any remaining questions that haven't already been addressed. So to start off, I'm going to start going through some of our questions that we received just about CDAS, general policy questions. Jessica is going to then go over some workforce questions that we've gotten. We have Amanda who's going to give some responses to questions about the nurse assessor process. And then we do have the Community First Choice team here who's going to answer questions that we've received regarding Community First Choice and then difficulty of care payments. So to kick us off, one of the first questions we got is we had a question asking if the minimum wage, if the maximum wage paid out to caregivers for CDAS will also be raised 1.6%, like the budget increase, or even higher now. Great question. Yes, the maximum rate will be increased to $58.02 for CDAS. The maximum rate is based on the highest 15-minute rate. And so for CDAS, the highest 15-minute rate we have is the health maintenance activities rate in Denver County. So 5802 will be the new maximum hourly rate for CDAS, and more information will be coming out to members if they're interested in updating their maximum rates. We had another question come through where an individual was told by Consumer Direct that they now could have 2 attendants working at the same time. And they're not sure exactly how that would work, but Could they have one attendant doing homemaker services while another attendant is performing personal care, health maintenance activities? Please verify. This is allowed for CDAS. This is also allowed for IHSS. So if there's two attendants who are providing different services, so in this example, one attendant is providing homemaker and the other attendant is providing personal care, both attendants could be clocked in to provide services at the same time because different services are being provided. Unless there's an extenuating circumstance where an individual needs like a two-person assist, so maybe somebody needs two people to help them in their transport, or there's, additional allowances in the member's specific support plan. So unless there's a circumstance like that, two attendants cannot be paid to provide the same care at the same time. But if it is different care, that is allowed. Alrighty, and then the final CDAS specific question that we got through was regarding the cost to you, and questions about if the cost to you changed at all or when does it change. So the cost to you changes annually, usually between the months of December and February. And then if there's any other changes to premiums for the year. So for example, in February this year, the sick time premiums changed. And so as a result, the cost to you also changed. For 2025, the cost to you has changed twice. Once for the new SUTA rate, which is a tax rate, and then again for the adjusted sick leave and family premiums. The best place to find the appropriate cost to you is on your FMS's website. So each FMS vendor will update their cost to you and update the form on their site for you to use. Alrighty. Were there any questions I think about the responses I had? Jose, I saw you come off mute.
Yes, Daniel. Thank you so much for what you're informing us. Does that mean that they will also update the CDAS estimator that they usually send you?
By the estimator, are you talking about the on the cost to you form where you put the rate in and it tells you the amount? Yep. So that form will get updated anytime they update the cost to you percentages.
What do you know by any chance? Where was the last time they did update it?
When it was? Is that what you're asking?
Yes. Uh-huh.
I think they updated the forms on their site in May, but the vendors, I don't know if anybody wants to correct me on that one.
Okay. Okay. Thank you. Thank you.
Alrighty. Amanda, I see your hands up.
I am. I just wanted to read off a question that's in the chat from Anita. She was asking, can those two attendants being paid at the same time be family members?
Good clarifying question. Yes, there's this, especially once a member gets into CFC, there's no limits to family members. There would be limits if you're still receiving CDAS, where only 40 hours a week could be provided by family members. But yes, the two attendants, if there's maybe one parent is doing homemaker and one parent is doing personal care, both could be clocked in at the same time.
One more question in the chat for you, Danny. From Mayella, she asked, I know CDAS usually takes longer to set up because of the paperwork and FMS enrollment. Can we start the CDAS process before so that it's ready by the time we transition instead of waiting until after services switch over?
Yeah, Mayella, that's a great question. You're right. CDAS does take a little longer to get enrolled because there's additional training requirements and requirements with FMS with paperwork processes. And to answer your question, yes, you can begin the enrollment process prior to you switching over to CFC. And I would actually recommend that. It can take a couple of months to get through the CDAS enrollment. There's background checks that need to be completed and tax forms and trainings and all the things. So to ensure that you have time to get through the process before your services start, it is recommended that you start a couple months before you transition into CFC or are planning on starting CDAS. An important note is, though, even if you get completed with your training and even if you meet all of the other enrollment requirements with your FMS vendor, the services can't start until they've been approved on your prior authorization, and your case manager will communicate with you what that start date will be. Alrighty, and in the interest of time, I allocated about 15 minutes for us to get through the CDAS, workforce, and nurse assessor questions so that we could use the remaining 45 minutes to talk about CFC and difficulty of care, because I'm expecting those to be our big question segments. So I want to pass it over to Jessica, who I think can lead the discussion about some workforce questions we've gotten.
Thanks, Danny. Jessica here. We received 2 questions that were workforce related. The first question was, how do we access the attendant care directories to look for staff? And I think by staff, they mean specifically attendants. So we've got a couple really good resources for you all to find individuals to be attendants who have that background in providing care in the home. The first is our Colorado Direct Care Careers website. This is a website that is hosted by the state and also includes, some of you might remember a couple of years ago at this point, conversation around standardized training. So particular modules that will support individuals learning those key foundational skills to provide the services that are included in CDAS and HSS. So that is, and I'll put my responses in the chat so you have access to these websites. They'll also get mailed out after the meeting to those of you getting snail mail. So Direct Care Careers website, firstly, and then Consumer Direct still has its attendant directory. So that's on its website. It has a feature to both find attendants for members or ARs looking for them, as well as for attendants to find a CDAS or IHSS member in which they have posted they need attendance. So I would definitely start with those 2 resources and see how they work for you. A quick Google search can also get you to other similar types of resources like care.com. Craigslist used to be a little bit more reliable in the past. I would be very careful how you use sites like that, but definitely getting creative at this time we know is important because finding good caregivers is difficult. The second question we received is, my caregivers are quitting. What do I do now? So same kind of response as my last, using the resources that are available to you, doing your best to get creative and relying on your support networks to help you. I think the first step when that happens, if you remember, is contacting your case manager, making sure that they are aware that your level of attendance support might be declining and that you are doing your best to find attendance, but may need their support in that process. If individuals are quitting or you have terminated them, you also want to, and you're on CDAS, you also want to contact your FMS to go through its process to formally separate that person from you. That's a good just general practice to make sure, especially as it relates to those benefits like family that rely on how many employees you have that you're not charged the particular premium for being over that amount. So that would be the 2 key things I would start with. Of course, if you need more assistance or just guidance with this, Consumer Direct for Colorado is a great additional resource to reach out to. Their INA services can really assist you in getting really hands-on, individualized support in recruiting new people and also retaining the folks that you already have. Okay, I see, Patricia, you have your hand up. Go ahead, Patricia.
Hi, yeah, I was wondering, I have been trying to get on the direct care careers site and I went through their help desk and I it's not letting me in. It's not letting me in. And I don't they had sent me an email to sign up for the INA, but that's not what I need. I just need to get into the website. So I'm not sure how to go about handling that.
Sure. Yeah. Consumer Direct can help you with that. So I know they're on this call. They can reach out to you after we're done with the meeting. I can assist you in connecting you with them.
Thank you.
Thanks, Patricia. And I see Kurt put
Renee,
in
I
the
got
chat. Real quick, Renee, let me just read off. Kurt said next door neighbor app works. So that's another resource for you all. Carly put in the chat for more hands-on support with INA. The INA referral is located on its website, and she put the link in the chat. Consumer Direct's phone number for those of you calling in is 844-381-4433. Go ahead, Renee.
Yeah, on the community first choice and nurse assessor, I sounds like they're connected. Are we in CDOS going to be going through the nurse assessor, and what does that involve? Are they going to be coming doing a visit personally with us?
I'm going to jump in here. This is Danny Kraus. Renee, you are teeing us up perfectly for our next section, which is we were going to talk about the nurse assessor process. And Amanda Smith is going to answer some of the questions that have come in, which are the same one you just asked. So I'm going to kick it over to Amanda, and I think she can answer some of the nurse assessor questions.
Okay, thanks.
Yeah, thank you, Renee. That does tee off for my second question, so I'll start with my other one and then we'll loop back around. But hi, everyone. My name is Amanda Smith, the Participant-Directed Programs Policy Advisor for IHSS. I'll be reading off a couple of the questions we received regarding nurse assessor. So the first one being the nurse assessor assessment using the algorithm in the final assessment, or is that a long way off? So what we presumed from this question is that we're asking about the Colorado Single Assessment, or the CSA tool for the assessment, the nurse assessor assessment. And the answer for that is no. The nurse assessor itself, they will be using the Skilled Care Acuity tool, which I am going to post into the chat a link to the nurse assessor webpage where you can find a copy of the acuity tool. There's also a resource on that page called the Skilled Care Acuity Assessment logic, which goes through how the assessment was developed and how the scoring was also developed. So that will give a lot more context for folks that are looking for that information. Thank you, Danny. She put that into the chat for those, and those on the phone will be sharing those links through snail mail, or however Bobby will be helping us out with getting those resources over for you all. The second question touches on what Robin just asked, is how will the nurse assessor program really work? Please provide a step-by-step example. So for this question, we will also be providing a resource. We recently posted a memo in our memo series titled The Nurse Assessor in Skilled Care Acuity Assessment Implementation. Apologies, that's a mouthful. And within that memo, we have a section that specifically calls out members and families what to expect throughout that process. And I would also recommend taking a look at our nurse assessor webpage. So I'll be posting in the chat a link directly to that memo for more information. I do know sometimes when I send the exact link for the memo, it comes through incorrectly. So if anyone clicks onto that link right now and it does not open, let us know, and I'm happy to share the direct link to our memo series page.
This is Cheryl Hargett-Dorset. I have a question
Cheryl.
regarding that specific title. For those of us that are not online, how do we access this information?
We can mail the memo to you all. We can include that in our mailing for
That
all
would
the
be
other
really,
attorneys.
that would equip us and help us a lot. Thank you.
Absolutely.
Okay. See, Erin, you have your hand up.
Hi, Amanda. So I want to just ask if we can elaborate a little more on the step-by-step, like what a member can expect. And I'll just mention that this is just getting started. In August, the nurse assessor will be working with families and members to get the skilled care part of services done. But Amanda, do you mind walking through, like, at a high level, like what starts first, and then when can we expect involvement with nurse assessor? Thank you.
Absolutely. Yeah. Happy to. So it really truly depends on where there's a couple different paths that a member could follow. So assuming folks in this call are already receiving services, if you are already receiving your PDP services, either CDAS or IHSS, the referral to the nurse assessor will derive from your case manager. So once your case manager places that referral to the nurse assessor, you will receive a phone call from the nurse assessor to schedule an assessment for that skilled care acuity assessment with you. So during that assessment, they'll be doing a clinical assessment on all of your skilled care needs and providing you a recommendation for potential hours in service modalities. So that may be captured through long-term home health, might be through private duty nursing, or you'll remain on your PDP option of your health maintenance activities. From that recommendation from the nurse assessor, your case manager would be able to authorize services, and you'll continue on with your services as normal. So that is really super high level on what that might look like. That certainly would look differently if a member perhaps was just receiving long-term home health currently, but assuming that we're all here for CDAS and IHSS, that would be the most common path that we'll be following. And just wanted to call out in the chat really quick, I believe that's Jim's hand raised, but in the chat is the assessment done at annual, and yes, that is completed. The referral will be completed at the time of your continued stay review. Referrals can be done 60 days in advance of a member's certification end date. And I know that brings up questions for folks of, hey, my CSR can be, or my continued stay review can be completed 90 days prior. The reason behind the 60-day is that a clinical assessment should not be completed more than 60 days out. We know that especially clinically, a lot of things can change even in those 30 days. So having that as 60 days rather than the 90 days was the best avenue there. Go ahead, Jim. Yeah.
Thanks, Amanda. I have a couple questions. The first one is, can you give us some practical advice on how to get ready? Because I've been hearing the high level 60-day thing and how you do it before now, then it goes to the case manager. What documents should we have ready? Have you guys thought about that? You've started it, or you haven't started it yet, but it's going to start next month. What are the things we can do as members of CDAS to make this part of it go smoother? Because you're loading everything up front now, and the last thing that I would want for my attending is to have I didn't have the right paperwork or whatever, and that pushes a delay in his CSR.
Yeah, super valid question. Great question. I see Erin's hand up. I'll let you go ahead, Erin.
Yeah, Jim, thank you. Great question. So I participated in piloting this with my family, and I've got people in my family who are on IHSS receiving health maintenance activities, and so I don't know if I would say lucky, but I was really excited to try to work through this and see how it's going to go in real life. But a couple of things I would make sure you have is just be prepared to describe what a normal day is like. We are used to, managing our care without nurses and without CNAs and self-direction. And that's such a privilege, but we have to be able to describe that. So, for example, I think the one thing that I kind of struggled with was when we were trying to describe toileting. And in the skilled care acuity assessment, they said, well, like, how many times do you need to, toilet or do bowel program? And I described what it was like. And then they said, well, we probably need to add time in because it's like what is coming up doesn't quite match what you're describing the needs are. So it was pretty flexible when it came to describing what a day of services looks like. And for me particularly, I'm speaking about children, so it might be a little bit different for adults, but I had my kids' seizure plans and asthma plans available. I had a list of medications and the dosages, as well as like seizure medication, like emergency medication information and how often we use that. And I think at the end of the day, I didn't have to provide a bunch of documentation because what I was able to describe made sense. In that case, I think the other thing to be prepared for is that you're going to be working with a nurse. The meeting might be virtual or it might be in person. And so just having, a list of things that if you have questions about, I don't know, let's just say you've got questions about respiratory care, they should be able to help you. But at the end of the day, they're trying to get a number of service hours authorized for you. The other thing that I'll mention is that for people in self-direction, we've always used a different tool. So CDAS, it was a task worksheet, and in IHSS, it was the calculator. And we've merged those together, and we have a new thing called the Direct Care Services Calculator. And so the nurse assessor is able to do that for people on self-direction to just really help outline what tasks are needed and how much time. And so overall, I think for us, the whole process was about an hour. And again, we were able to do it virtually. And I found it to be pretty easy to talk through. But I also really appreciated somebody having clinical knowledge about like skilled services. We're not going to go to private duty nursing or home health, but I think I'm hopeful that you'll find the experience helpful in service authorization. And I will just say, Robin, I see that like not a typical day. I personally, I'll just say I'm trying to go over what the last like 30 days looks like. And right now, the last 30 days have been really hectic and volatile and with a lot of changes. So I described that, and they're able to take that into account in figuring out the amount of hours. Hopefully this is helpful.
Thank you, Erin. Appreciate that. Oh, did I hear Renee? No, okay. Well, so go ahead.
Which one?
Renee, you could go ahead. Yeah.
Okay. So on this nurse assessor, they're going to call us?
Yes, they will be contacting you. Yes.
And if they contact, if our case manager contacts us for a case management review before they do, then what do we do?
That is more than okay and likely will happen because we do have those two assessments. So your case manager will be completing their functional assessment with you. And then once they call to schedule that CSR or your continued stay review, that's when they'll be placing that referral to the nurse assessor. So you should have from that point, once that referral is placed, it's one business day that the Telegen team will be contacting you to complete the initial call to schedule your assessment. So two separate phone calls for different assessments.
So if this is over the phone, I don't understand how this assessment is supposed to take place.
Yeah, I think it'll be helpful once we get you that information from the memo. The assessment wouldn't be over the phone. It does have to be face-to-face. And so I think if we give you some more resources, that might help. And I do apologize. I'm just looking at time, and I want the CFC team to be able to get to their handful of questions. But we have additional resources that we could certainly send to you, Renee, and I'm happy to do so and connect more over that.
Okay, fine. But we've been talking about this for how long now? And and I'm still like trying to figure out what are we doing it and how does this work, and so I haven't. I apologize, but haven't been able to follow what you guys are doing. But if that's all you're going to do is send us information, and then we got to try to figure it out from there. I don't understand, like how we're.
Amanda and everyone, I'd like to just kind of step in. The intent of this is that you actually have a nurse assess those needs. The best way to do that, obviously, is if you can, now past COVID, is to do it in person whenever possible. And I want to assure everyone from what I've seen on memos, ultimately the case manager still has a right to appeal and overrule that with some explanations. So there's a lot of concern about it being done right. I believe the whole intention of this was to make sure it in fact was done right, when in the past they felt there's a lot of people that had a lot of issues that really wasn't the personal involvement in need. So I didn't mean to speak up in there in front of anyone for that, but I think that was the whole idea behind this, is to get better service, try not to fear it, try to embrace it and look at it as maybe a better thing. All right. Sorry about that.
Okay. Is there something like this assessment's going to include the following items that you are going to need to be prepared to explain? Is there anything like that, or are we just winging this and it's like, I don't know, bring up something and hopefully I'll have the right, I don't like what is it going to involve?
Renee, I'll just share one more thing. There is a nurse assessors group that's been meeting, and they are putting together, along with that acuity tool that Amanda was talking about earlier, they are putting something together so you can better be prepared. Unfortunately, I will share, knowing that you're by phone all the time, a lot of this is online, and a lot of it they're going to have to make a point of mailing you, but you're going to have to kind of take that. So with that said, I don't want to get off topic, Renee. You bring up some valid points.
Hey, Kurt, Cheryl, I have something I want to add to what she's saying.
Okay.
And I will refer to my conversation this morning with my son's case manager. So your case manager will be doing one aspect of care. The nurse assessment will be doing a more skilled assessment of care. So it is two sides of one coin, two separate appointments. It will start with the case manager, and then the referral will be sent to the nurse assessor. They will follow up with a phone call and then set a face-to-face appointment. All of it will be face-to-face between the case manager starting, the nurse assessor finishing, and there is a time process for this. So, that's how it was explained to me this morning, if that helps.
Thank you, Rick. Thank you very much, Cheryl. Sorry to interrupt. I don't want to cut anyone off. I see Victoria, you have your hand up. Jamie, you have your hand up. But I think I'd like to continue with the open questions and answer session, and then we'll get to those questions you have in a little bit. All right. So, all right.
I don't mean to interrupt, but I didn't want to get skipped on this. This is vitally important. Renee, my name is Victoria Mal, and I'm with Impacted Caregivers, and this is exactly what I do, is to help people walk through stuff that's online, paperwork, things like that. I am a breeze at it. So if you need any help at all, feel free to reach out to me. I'm sure there's a lot of people in this group that know who I am and my contact information, but I would absolutely love to sit with you if you need it and walk you through the internet. I have a laptop computer. You don't even need to have one. I'll just hold your hand. I'll walk you through it. I'll explain everything. So I want you to know you're not alone and you're not expected to swim through this alone.
This is Cheryl Hargett. I raise my hand and echo on that as well.
Awesome. Thank you very much. You guys are awesome, and that's why we have this great meeting where we can share that. All right.
I need that person's name and contact information, Kurt.
Okay. If you guys can put that in the chat, I'll copy and paste that for everybody.
But I don't have. I'm on the phone.
And you know I can know how to get a hold of you, Cheryl.
Okay, will do.
And if you could send that on email to us.
All right, we'll get it in the chat. We'll get it out to you.
Alrighty, thank you, Kurt, and thank you so much, Victoria, for offering to help. That's really, really nice of you. Agree, ditto, Kurt. We have a great group of people here, so really appreciate you all. So let's move us over to our CFC questions, and I'm going to pass this over to our CFC team, and we have Maddie here.
Hello, everybody. My name is Maddie. I am with the department on the CFC team specifically, and I will be going through the CFC questions that we received ahead of time. So the first question, the first three questions actually all kind of tie together and have the same answer. So first is, why does the 40-hour cap start at the time of the person's recertification? Can someone explain if all of the new rules of CFC would apply to those members who will not have their CSR in future months, or is it just for members beginning in this new CFC program? And finally, how about the 40-hour max? Does it only pertain to old non-CFC plans, or does the new max 16 hours per day apply to the old non-CFC and those starting with CFC now? So the simple answer is that the new CFC rules will apply to members once the member begins receiving services through CFC, which will happen at the time of their recertification. So let's say that there's a member who has their recertification January 1st of 2026. They will continue to receive their services as is with the existing 40-hour limit, etc., up until January 1st of 2026. On January 1st, 2026, the member will transition to CFC, and those new limits will apply, and that 40 hours will be removed. The next question that we got was, is the state getting the 6% match beginning July 1st, or is it only for those plans when they actually begin under the CFC program? And similar answers, so the 6% match will be claimed for services billed under CFC. So once the member transitions to CFC, at the time of their CSR, that's when the 6% match will be received. And I am seeing Jim with their hand up. I'm happy to take that question.
Yeah, Maddie, can you delve into, you talk about transitioning at CSR. I get that. What are the changes for us when we switch over to CFC? For example, do our EVV requirements change? What is the impact going to be specifically for the people that are on this phone call? Thanks.
Yes, that is a great question. And I think generally speaking for EVV, it's going to be the same codes, the same call-in process, all of that, those rules will still apply. In terms of the specific changes for people on this call, I might tag in either the PDP team or Eileen, just to kind of go over those specifics.
Maddie, this is
I know there are some specific changes. Maybe some of the Consumer Direct can address those as well once you're on the CFC program.
Yeah, Kurt, this is Danny. I'm actually, I'm going to just address high level what the changes are for the benefits that are moving into CFC, because our team specifically manages the benefits. So I think we can cover that for you. So for IHSS and CDAS, if you currently receive it through the waiver, you'll know that there's some like family caregiver limits that you navigate through. Once you get into CFC, one of the main changes you're going to see is that 40-hour-a-week relative caregiver limit is going away. Once you're receiving CDAS or IHSS through CFC, you'll be able to receive however much care is in your care plan by relatives or family members. There will be a new limit for legally responsible people who provide homemaker. So if you are an adult and your spouse provides homemaker for you, your spouse will only be able to provide 10 hours a week. Or if you're a parent providing homemaker for your child, parents are limited to providing 10 hours of homemaker per week. That's not to say that parents and spouses can't also provide personal care or health maintenance activities. That is permitted. But if they are providing homemaker, that'll be limited to 10 hours a week. Another change that you'll notice when you get into CFC, after moving from the waivers, is that there is a caregiver limit at 16 hours a day. So that means individuals, that means any attendant can't work more than 16 hours in a given day. This is really to preserve our attendance, to not allow anybody to work over 16 hours consecutively in a day. In regard to EVV or just general processes, though, you're really not going to see a change. EVV requirements are the same. The exemptions for living caregivers, those are remaining the same. You're really only going to see some changes specific to caregiver limits. Those are fluctuating a bit. And then there have been a few adjustments to tasks, which we've gone through in our rule updates. So for reference, one of the new things that you'll have access to is acquisition, maintenance, and enhancement of skills. That's going to be some habilitative support that can provide like teaching and training to attendant. Oh my goodness, words. It can give training and coaching to members, So if you're a member and you would rather your caregiver teach you how to bathe so you can get those skills, they will help you with that instead of just providing the bathing for you. I think that covers the bulk of the changes. PDP team or anyone else, if I'm missing any though.
Danielle, thanks. But my little research I've done, people that are on long-term care, all the services don't transition over to CFC. So, I mean, I think that's something you need to make people aware of. Like, for example, my son gets Medicare rides. That he can't get that through CFC. So he needs to, I think that's something you guys need to highlight to the people, the audience here. That's an important thing.
Well, he'll keep his rides. So the CFC is just a new way of accessing CDAS. So all of the services that were previously available, they'll continue to have access to. So if they get non-emergency medical transportation or non-medical transportation through the waiver, they'll continue receiving access to that. The addition of CFC doesn't change those other services.
We have a few other people with their hands up, Danny.
Thanks.
Jim, was that you just talking, Jane and Jim? If not, Jamie, I see you have your hand up.
Yeah, I was wondering if the spouse or the parent don't have legal guardianship of the member, are they still under that 10-hour limit?
40-hour.
Oh, the 10-hour limit under homemaking. I'm sorry.
Thank you.
Go ahead, Maddie.
Sorry. Yes, that I was seeing there's a similar question in the chat.
Yeah, I see that too.
And there's another one that was sent in. So I think it might be helpful to just go over what the legally responsible person is. So legally or entails, I guess. So the legally responsible person, for the purposes of that 10-hour per week homemaker caregiver limit, for a child would be, or under the age of 18, would be the child's legal guardian or parents. So to address the question in the chat of does the step parent count, only if the step parent is the legal guardian. For an adult member over the age of 18, a legally responsible person would just be the spouse of that member. So if the caregiver or attendant does not fall under those definitions of the legally responsible person, they can provide the services and are just not subject to that 10-hour per week limit.
So they would have to have paperwork saying that they're legally responsible, right?
If it's a
Danny,
step,
I might defer
yes.
to you, Matt, but
So if your spouse.
Right, so we're not to assume, I mean, I don't want to tell a wife of, let's say a husband or a wife of a member that they can have more than 10 hours if they're not legally responsible. So if they don't have guardianship or power of attorney or any of that.
No, it's just if they're the spouse. So spouses don't have to be a legal guardian if you're married. The state of Colorado, not even us, like it's broader than us, defines a spouse as a legally responsible person for another adult. So
Okay,
it
that's
doesn't matter.
confusing.
Yeah.
So just
Hear
the term spouse, it applies to the term spouse, not if they're legally responsible then. So if they are a spouse, they can only have 10 hours, right?
Of homemaker.
Okay.
Well, that's probably the most sexist, ableist thing I have ever heard.
Thanks for the feedback, Robin.
Is that a federal term or did you guys come up with this idea?
It's been a term that's been in Colorado rules for a long time, like over a decade. A really long time.
And it is federal. It's not HICPUF, it's federal.
Thank you.
The 10-hour
Well,
rule?
now would be a good time to change it because it's absolutely offensive. I mean, you made it worse by not, by not making it a child. You actually made it worse by saying, oh, you're only legally responsible for your adult husband. There's nothing that says I'm legally responsible for my husband. It's offensive. And if it's at the state level, it needs to be changed. There's also nothing that says I have to do all my husband's laundry. That's sexist.
Thank you for the feedback.
There's nothing that says I have to cook, clean, and do all of his laundry. Honestly, I was in marriage before. I did not cook, clean, and do all.
Come on now.
Thank you for the feedback, Robin. We appreciate feedback and definitely understand there may be some concern with the language. The regulatory language for CFC, though, did go through the public rulemaking process and extensive stakeholder engagement. At this point, we're unable to change the policy or regulatory language for a legally responsible person, but we do always appreciate the feedback.
No, you don't get off on that. You know now how incredibly offensive it is to spouses. So you have the ability to change it and come up with something that's not sexist and ableist. You guys changed all the mentally retarded stuff. You can change this and be respectful of my husband.
Robin, thank you. So just everyone on timing, we do have other things we need to get to. Robin, I hear you. I will pass on your concern to our leadership immediately. Thank you.
Great.
Right.
Sorry, this is Maddie from the department. I was just going to say, I believe that wrapped up the CFC Q&A portion of the pre-questions that we got in. I was going to pass it over to Eileen Saunders to go over some of the difficulty of care Q&As that we received. But I'm not sure. if there are any other questions for CFC specifically. Otherwise, I will pass it over.
I do have one comment. Keep in mind on the 10-hour rule and also though under CDOS, not exactly sure on IHSS, that you could choose to pay someone more per hour, including a spouse, and use less hours. I just want to make sure everyone understands what I'm saying there. The limit is 10 hours with the intention that family is not doing a whole lot of extra work that they shouldn't be doing, that they normally do in the course of cleaning a home. But keep in mind, we do know there are circumstances, whether it's extra laundry or other things that are included in their homemaker that may actually entail more time. So again, I'm just trying to clarify for everyone. And Danny, I'm going to respectfully disagree. We had talked about this many times with engagement by stakeholders, but pretty much we're put in our spots. So my apologies on that. In the meantime, let's keep things moving with the next topic.
Hi, thanks everyone. Hi, this is Eileen Saunders with the department. I'm on the I shouldn't say under. I'm on the Community First Choice team, and I can help kind of talk through some difficulty of care questions that we've been receiving from stakeholders today. So I think the first thing I'll just go over is what is difficulty of care. So difficulty of care, that term applies to a certain type of payments that the IRS deems into a certain category. So the IRS classifies difficulty of care payments as certain foster care payments for providing additional care to a foster child that is required due to the foster disability. That definition has been granted to HCBS waiver payments as well by the IRS. So essentially, what we mean when we talk about difficulty of care payments are essentially payments for certain HCBS services that are excludable from federal income tax under the IRS code. So in order for those payments to be excluded or to qualify as difficulty of care payments, the caregiver for a member on a waiver must be in a waiver, and the caregiver must live in the same home as the member. And the caregiver then receives payments through either IHSS, CDOS, home care or home health agency, or a program approved service agency. So that's what we mean when we talk about difficulty of care. It specifically impacts the payments for a caregiver who is providing care to a member on a waiver program. So we, as many of you are aware, we implemented Community First Choice, and many of those services, such as IHSS and CDOS, are moving from or have moved from the waiver programs to Community First Choice. And in order to ensure that the difficulty of care payments apply under CFC, the department issued what's called a private letter ruling in February to the IRS to basically say, like, hey, IRS, these payments are the same, services are the same. Can you please apply that same exemption criteria to Community First Choice as you do the waiver programs? The reason we applied for that in February is because we needed federal authority for Community First Choice first before submitting that private letter ruling to the IRS. So we received our state plan amendment approval from CMS, our Centers for Medicare and Medicaid Services, in late December. And then in February, we submitted that private letter ruling. we're now working directly with the IRS on that ruling, and we expect we should have that in the next several months. They usually say it takes about 6 months from when they receive our private letter ruling. So when we get that notification, we will absolutely notify all of you through all of the constant contact methods and get that information out as soon as we get it so that you are updated and aware. And we are also working on more plain language resources around difficulty of care, what it means. We know we've been asked for that, so we're working on that now. And so I'll just pause here and, this is a complicated topic, so I want to make sure I'll pause and give time for any questions. Oh, hands went up really fast. I don't know who was first, but I think Megan, you were first. I'll go.
Dan's like, I'm not sure either. I wasn't looking that closely. So my understanding and from our previous conversations is this is essentially falling into that same, CFC services are falling into that same way CNA services have always fallen, where it's paid out of state plan, but it's if the person's also on a waiver, then it's still considered difficulty of care as far as Colorado's concerned, and the IRS has seemed to uphold that without even having this special letter saying that it falls into that category. So it seems logically to me, CFC is now falling into that same sort of weird gray area. For parents who have been CNAs for their own kiddos that are on a waiver, historically, we've had the option when being an employee through a home health care agency to choose. We want to have taxes taken out, and you can choose to have them taken out and pay taxes if you really wanted to, or you can get a refund, or you could choose to be exempt from the beginning, and kind of that onus was on the family. Versus under CDOS, that decision has always been made for people because they were on the waiver. It clearly met this notice by the IRS, so that decision was made by the FMS providers following that. And so there wasn't a choice. You couldn't choose under CDOS to have taxes taken out if you were a live-in caregiver, even if you wanted to. So is my understanding now, CDOS and IHSS under CFC will now be treated the same way CNA has been, where it's up to the individual care provider whether they want to choose to have taxes taken out or not, because it's in this sort of weird gray area? Or is it where they have to have taxes taken out and get a refund later if it all pans out in the meantime?
Great question, Megan. There's a lot there.
I want to answer that a little bit.
Yeah.
I just want to say that, number one, the difficulty of care exclusion by the IRS is for the employee. Primarily, it's not just tax exemption, which in fact it is, but also when you apply through the employee FMS, it does not show up as wages on a W-2. That's the important factor, because not showing up as wages also means it does not disqualify someone else who is also on Medicaid or another government program. So
right. But like you've always gotten, I get a W-2 for my CNA income, and I still am able to exclude it as difficulty of care, even though I get a W-2. I have to do more.
Yes, everyone gets a W. You will get a W-2. You do get a W-2 for Social Security taxes and other things that are not taxes. Those are not the same. This is meaning that you will get a W-2, but under wages as income earned, it does not show up as earnable income and is not claimed on your taxes. And I really think
CNA has always showed up as earned income on a W-2, and then I have to go back and exclude it later on or request them to not take any taxes out of it. But for CNA, it has always showed up as earned income on a W-2, and then you have to navigate it out with the IRS later.
Okay.
And when you go
is that
to
through IHS, is that through IHSS?
CNA, which is paid out of state plan. So it falls in the sort of same weird category of CFC that's paid out of state plan. And if I wanted to apply for Magi Medicaid, when I go to report my income to the state for Magi, I would report that income and then mark it as difficulty of care, and then they would go back and exclude it. So it's like
Okay.
it's been excluded in the front end, and under CNA, it's had to be excluded on the back end. And so my understanding is now CDOS is going to have to be excluded on the back end instead of on the front end
If I
until
could
we get a letter from the IRS. Yeah.
jump in, I think we have a representative from PPL that might be able to answer what it's going to look like for CDAS specifically.
All right.
Hi, I'm Shane McCool. I'm with PPL. I'm the Senior Director of Tax Operations. And I just wanted to clarify on what you're saying, Megan. Yes, your concern is valid, but given the fact that the CFC is under a different Social Security Administration section, we do require clarification with the IRS in order to treat the wages as DOC. So we are hoping that the IRS will get back as soon as possible, and we have very favorable responses from the IRS with other state programs that are very similar under a different Social Security Administration code. So we anticipate that the IRS will agree, but in order to protect the employers in the program, we need to make sure and treat the withholding properly. And because it's specifically laid out in the rules, we will be withholding when until the CFC IRS ruling comes back. And then for 2020, we're hoping by fall 2025 we'll receive it. So that way all FMSs starting at the very latest January can reapply DOC where applicable. But other than that, for this period starting January 1st or any transition that occurs thereafter, it will be taxable. And if the private letter ruling comes back favorable in CFC's, in their favor, they will, you will be able to do it on your 1040. There's a special section now on that, and on the W-2, those wages will be in box 1. Once we do receive approval from the IRS, it will go back to where the wages will be reported as DOC for those who are properly qualified. So it's because of the gray. I understand the gray area, but we're trying to make sure that we protect the employers under the taxation with the IRS.
Yeah, I get it. And I think, it's better for you to take taxes out and people get refunds and when they file their taxes, when this all gets settled, than for you to not take taxes out and then it come January and everybody owe a significant amount in taxes when they file in the year. So I get that, like, it's better to be protective. I still think it is the same as CNA in terms of where the funding is coming out of state plan instead of coming out of waiver specific funds. And we've had to go back and argue on an individual case for it to be tax exempt without this special letter from the IRS for years and years and years. It would have been nice if we had a special letter from the IRS saying that CNA was exempt. And so I'm glad that we will have that, fingers crossed, in the nearest future. But I just want to make the point that, like, we've been navigating this weird muddy water with CNA for a long time, and that this is very similar to that muddy water we've been in.
Yeah, understood. Appreciate your points. And I think Patricia's question was answered by Jose in the chat, but as people transition or newly enroll in CFC, the removal of the DOC exclusion will apply, but current CDAS members, as long as they haven't transitioned to the CFC, and Danny, please let me know if I'm misspeaking, but they'll be treated as DOC per usual until they do transition to CFC.
That is correct. And if we get the private letter ruling before somebody transitions, then that solves that.
Exactly.
Okay, exciting conversation. I see if we feel it, still have a few hands up. However, we are getting to that point. It is 2:21. We are about to get into open forums. what I'd like to do is wondering if we want to work through here and said we had meeting chat review if needed. I'm missing something here. Do we not have the breakout rooms here? Oh, not till 2:35. I'm sorry. Why don't we, if everyone's up for it, why don't we work through break? I think there's a few more questions we want to answer. Any objections to that as opposed to taking a break?
I think it's appropriate.
All right. Victoria and Jessica. Jessica, you've had your hand raised for a while.
Hi, can you hear me?
Yes, we can.
All right, mine are quick. So are there taxes? We are deciding to go with IHSS instead of CDOS. Are there any taxes taken out of that, or is that a difficulty of care payment through Community First Choice?
So, Jessica, IHSS is moving to Community First Choice. So I think, but under the waiver programs, I think what you're asking is, does that qualify for difficulty of care payments? And yes, that does under the waiver.
Yeah, well, we're doing waiver. We just got approved for the waiver in Community First Choice, and we've never done any of this, so I don't know if that gets taxes taken out, if I should be calculating that or not.
I can just speak on the benefit side if that's okay. So for IHSS, your IHSS provider agency will walk you through anything that's necessary. You won't necessarily need to make the tax decisions with IHSS because IHSS members don't have the budget authority in the same sense that CDAS does. And so however your IHSS agency decides to handle your taxes is they'll be able to answer your questions more specifically.
All right, no problem. And one of the memos that we just got said that taxes are going to be taken out of live-in caregivers under CDOS. Is that true?
Yes, that for individuals who are on CFC, taxes will be taken out.
Okay, is that until we get the approval from the IRS for that difficulty of care, or is that just taxes always?
I might have to punt that to one of our FMS vendors to be able to speak more specifically about what that looks like. Taxes, just generally speaking for CDAS, can be specific to individual circumstances. And so while the difficulty of care tax exemption is changing until we get that private letter ruling, taxes are a little different and things get taken out in different ways. Jay, I don't know if maybe you can speak to that too. See if
I just want to throw one thing out there, guys. For everyone as an employee, and you're listening to all this, I don't see a single person on here who is a certified tax advisor or attorney. So please make sure you get your tax advice from a legal tax attorney or whoever you do your taxes with. Other than that, we're given kind of conjecture and knowledge, but we're not legal advisors. So please understand that. Just want to throw that out there to everyone.
No, thank
Correct.
you.
And also, this is Shay again with PPL. As we are the preparers for the payroll tax, we cannot give specific tax advice like Kurt says. But we are following the rules and the fact that where the funding is coming from is not currently approved for IRS difficulty of care exclusion from taxable income and federal tax. So we will PPL will be withholding until we receive the private letter ruling, and we're very, like I said, encouraged by historical responses of the IRS. We just cannot use them as primary source because a private letter ruling is specific to each program and does not allow you to pass that along to similar circumstances.
I'll just share that it has been approved in California and another state as well. So with that said, I see we have Victoria, you still have your hand raised. Any other comments up there? Jose, I see you have your hand raised. Jose, if you're available, go ahead.
Hi. Is it my turn?
Yep, go for it.
Okay. So this is just a generalized overall. We continue, and I'm sure Megan and Kristen, who are also on this call, can confirm this. We are continuing to see families that are stating that they're not getting responses from case managers, from, you know, the CMAs that they're supposed to be working with. I can't even begin to tell you how many I've seen in the last couple of days. One especially that I set aside is where one family got an email from a case manager that said she's out of the office. Don't bother leaving a voicemail or whatever it was. And this family's stuff is due. And there's other ones that are, you know, been waiting 6 months for Telegen. Another one that she said she went through 6 caseworkers in, you know, God knows how many times. And her paperwork's not on time. And there's just a lot of families in limbo right now. And the feedback I'm getting from some CMAs is, you know, they're overwhelmed. They're vastly overwhelmed with all the new changes, all the trainings they're going through, yet not having enough staff on hand. And then there's case managers that want to quit because they're getting yelled at and cussed at and things like that by parents who are equally frustrated because things are not happening on time like they should. So there's families that are suffering. There's children that are losing services, or, you know, they're in the middle of whatever this black hole is. And there's, you know, CMAs that are not able to keep up. And I have brought this up so many times in recent meetings and haven't heard nothing other than, well, you know, where you can file a complaint. Well, if you know of something or somebody, you know, you can contact us. But it's still happening. And not only is it happening, but over the last 2 weeks, it's happening at a huge growth. And we're what, 2 weeks, I believe, 2 weeks away from the nurse assessor hitting. And if they're already overwhelmed and we're already having these black hole problems, what's going to happen when the nurse assessor hits? What happens to families then? What happens to the families that are still waiting and are told, can't get a hold of your case manager, they quit today and we don't have anybody else to cover? So I would really love an answer, and I think everybody else would love an answer of what's happening, what's going to happen, and where's the protection for the families in all of this?
Hi there. Thank you for your question, Victoria, and for sharing your experience as an advocate and working with families recently. I put a link in the chat, but what it is the escalation web form, and my request is please use that. That is managed by HICPUF staff, and we work through cases as soon as we get them to try to get to a resolution. And I know there might be some trepidation or fear about putting a complaint in. You're not putting a complaint, you're escalating an issue, which might be eligibility, or we can't find our case manager and we have no idea how to reach them, or like our PAR has expired and we can't clock in and out. Like, you name it, please put it in the web form so that we can track it, and then we are able to effectively manage that from the state level. And I do want to validate, I know there's a lot of changes for everyone, and case managers are really crucial in making sure that things go off without a hitch and that members have services. But if you are in a situation or you know someone who needs immediate support, please use the web form. It's the most effective way to ensure that we get the number one, things documented, and then number two, that we can work through the issue. We can't just keep talking about, oh, things are hard, but without the examples, we can't help fix it. So I would ask for your support, and anyone on this call or on the phone or in the webinar, if you can please use the escalation web form, that would be really, really helpful. I will check on if there's a phone number for escalations. I'm not certain about that, but we will check on that, and I'll let you all know shortly.
And then
This is
Aaron,
Cheryl
my next question to bounce off is there's a lot of families right now that are in this situation. So if they fill out this form and it goes to you guys, do you guys have enough staff to respond to all of these that you would get? Do you have enough capability to help all these families and muddle through this in a timely manner? Because there's a lot of families, and if you guys get slammed with these and you don't have the capability or the staff to handle them, you're going to be underwater just like everybody else seems to be.
Thank you for that question. So there is a dedicated team that works on escalations, and we help when it's related to CDAS or if it's related to case management or IHSS. So again, without a report to us, like we can't work on it. So I would just ask, even if it's a lot, don't worry about that. Please submit your escalations if possible.
Without a doubt, no one can work on it if we don't know about it. Jose, you still have your hand up. I hate to keep it moving, folks. We are approaching our time for a break room.
I have a question regarding this escalation form.
Oh, okay. I'm ready.
Can I address it?
Yes.
Yeah, this is Cheryl Hargett Dorset. My question is pretty simple. On this new nurse assessment protocol that will be implemented as of August, I believe, if I'm hearing correctly, this escalation form can also be used if there is a due process in place from disagreement from case management to the nurse assessors. Since it's all HIC related, I just wondered if that is a process that is open to us as consumers.
Thank you, Renee. Great question. That's
not Renee. That's Cheryl Hargett Dorset.
I'm sorry, Cheryl.
Honey, it's okay. It's a long
Let
day.
me just say, I apologize. Here we are. I'm still a little jet lagged, everyone. Here we are. So we're finding about a phone number for the escalation web form. When it comes to disagreements or appeals, or if you don't agree with the decision that a case manager makes or an agency is requesting for services, you can always appeal that. There are appeal rights given at every CSR, as well as when a PAR is developed. So that is still in place. And if you do appeal, there is a continuation of benefits. And so none of that is really changing. Yes, you can use the escalation web form for things like that, but there is a different process. So what may happen is that we will direct you to a different, maybe a specific person, or direct you back to case management if we need to go a different way.
Yeah, I'm well familiar with the litigation due process. I just wondered if the escalation form can also be applicable to the nurse assessor's review. If they're stuck, if the nurse assessor's group is stuck between an agreement with case management, is it rational to, as a consumer and a guardian, to consider an escalation form to HCPF?
That's definitely your right to do that if you'd like. I will mention that the nurse assessor is only making a recommendation. So the case manager has the final say on what services are needed, and they have the authority to put in a prior authorization or PAR. So if you disagree with your case manager, that's where you'd follow the normal appeal process.
I do understand that. So I guess what I've concluded from hearing all of this today is that the nurse assessors are almost like an overview in the skilled side of reviews. Is that correct?
That is correct. And for health maintenance activities, it's the first time ever that a clinician or a nurse will be looking at and assisting with your care plan development. So we've had unclinical people for a long time, and we're really hoping that this improves the services that are authorized.
Thank you for clarifying that, because that is my understanding. I'm just concerned about the nurse assessors training in brain injury and things of that like.
Great. Change is always scary. There's no two ways about it. Hopefully it's better.
No, it's for me, it's about, I don't take my son to a primary doctor when he needs a specialist. So I take him to a brain doctor when he needs to address brain issues, or a gut doctor when he needs to address gut issues. Are they going to have those kind of specialty skills to make their assessment?
I will just say that one of the requirements of the contractor, who is the nurse assessor, is that they are well versed in disabilities ranging from things that affect children to adults and seniors. And so there are a lot of contractual requirements, but one of the main ones is that they understand our programs and benefits and our program rules in Colorado and health maintenance activities and how private duty nursing and home health work. They do need to know all of that. And one of the benefits of having this expertise is hopefully that more people will come into self-direction and get out of maybe services that don't quite meet their needs via CNA or private duty nursing.
Okay.
But thank you for feedback. And I'm sorry, Kurt, like you're in charge. I'm going to go back on mute.
All right. Yeah, I think we want to keep the ball rolling here. It is 2:35, actually 2:38. Time for our breakout sessions. I just want to say, Jose, I keep seeing you shake your head. You got your hand up there. Do you have any other questions yet, Jose? You've been waiting patiently back there.
Yeah, I just want to make sure I understood something from Shay, from DTO, Shay McCool. When you talk about the difference between the tax for CDAS not being authorized for CFC, that only applies for difficulty of care people. It doesn't apply for people who do not qualify under difficulty of care, right? That remains the same.
That is correct. It doesn't affect anything other than that.
Okay, thank you
Any
so much.
relationship exemptions for FICA or unemployment tax are not affected.
So as long as they are W-4, they don't live with you, they're not family members, everything remains the same.
Correct.
Thank you.
All right. Jessica, I think I'm going to throw it to you or Danielle on getting us in the breakout rooms. Thank you for the lively conversation and feedback, everyone. I think hang out and get in a room, and then we will meet for a final open forum afterwards for final wrap up and discussions. So, all right. I see the breakout rooms are down there. Everyone wants to feel like they can pick one, join one of the 3 meetings, advocates or members only, IHS, and of course, FMS training and case managers. Great. I see we got 55 people back. Great meeting today, everyone. I'd just like to move forward with thanking everyone. And we do have one more breakout room, open forum scheduled here. And because we know that we get sidetracked on the first one, a lot of times people didn't have a chance to speak up. So if you haven't got heard regarding something that we have not talked about so far, I would like to talk about that. Please raise your hand or put your name in the queue. Jessica, I see you have your hand raised.
Yeah, hi. This morning we finalized our direct care services calculator with our case manager, and she was asking me if I had my CNA or not, because she said there was a little checkbox that changes things when she checks it. But since the Nurse Practice Act is waived through Community First Choice, I'm wondering why that box was there and why it moved things around, whether I had my CNA or not. Do you know anything about that?
I personally don't know anything about that. Anyone else? Maybe
This is Erin. Jessica, was this an agency for like case management agency form or like a provider agency
Rocky
document?
Mountain Health Plans.
Okay.
So
Yeah, I'm not
case manager.
Okay. Yeah, I'm not familiar with why you'd need, like for CNA, you'd need a CNA license, but or certification, but it's not necessary for CDAS or IHSS. So I think there is, so in the hiring process, if you do have a CNA certification or a nursing license, we do have to check that it's still intact and it hasn't been revoked. But otherwise, there's not really any need for it.
Right, because she said when she checks the box that says, yes, I have my CNA, my son will get more health maintenance hours. But when she unchecks it, I'll go to personal care. So I'm like, well, that's a big deal because I don't need my CNA for a community first choice. So I don't know who I should talk to about that, or
we'll put I think our emails in the chat, but if you don't mind connecting with my team, the email will be in the chat shortly. Thank you.
All right, thank you.
Anyone else? Any other open forum items? I'm not seeing anyone. Any hands raised? All
There
right.
is one hand raised.
All right, go ahead. I'm not seeing it on my screen. My computer's been different. Hey.
So
Yep,
it's actually Dan Olson using Delia's account. So I did have a question, and this was kind of one that I developed more in the IHSS one, but with the new nurse assessor, just wanted to make sure, and I have a feeling this question is probably for Aaron, and I apologize if I'm kind of dense and taking this in slowly, but from what I'm understanding based on the conversations today, it sounds as if essentially home care agencies are going to be taking a step back as far as having really any kind of involvement in the care plan development. However, may still participate if they're seeing issues on the front lines in kind of pushing that up to the case manager and maybe the nurse assessor to be able to review those, but essentially will really take kind of the backseat of receiving all of that information from the nurse assessor, from the case manager, implementing it on our side. And so then kind of a secondary question to that piece of it is then it sounds like if that's the case, we probably will not have to have a nurse, our own nurse, participate in intakes.
Great question, Dan. Thank you for both of those. So the agency requirements for their RN are outlined in regulation, and I would highly recommend you go take a look at those. It's the agency's licensed healthcare professional, and so there's still a lot of work that needs to be done by the agency nurse. We just are not permitting agencies to develop their own task worksheet or direct care services calculator and provide that back to the case manager. You'll need a care plan. You'll need your nurse to do skills validation. There's a lot of requirements. So I'd go back to that. And then lastly, in the IHSS legislation and the law, we require that IHSS agencies have a nurse, and it has to be a registered nurse. So that can be a contract position or someone on your staff as an employee, but that's required by the state law.
Okay, so it sounds like nothing's changing as far as that aspect of it. Perfect, thank you.
Yeah, absolutely, thank you.
Anyone else out there? That is my hand up by accident, everyone. I see, is that Cheryl with your hand raised? I see someone with the number ending 762. Whoever that is, please feel free to talk. Okay. Anyone else? I am limited. I can see about 5 names on my screen. Now I get more. Anyone have any forum items? If not, if they do, please feel free to bring them up now.
I have one thing. This is Erin.
Okay, Erin, go.
Earlier, we were chatting about the escalation web form, and if there's a way to make a report or submit an item for escalation via phone. And my case management partners have confirmed that there is a process to use the escalation web form via phone. I will provide the phone number and we'll put it in the chat, but it's our member contact center, 1-800-221-3943. And you can ask to create an escalation ticket. And then they will route it to the right people and put it into our system. So again, that phone number is 800-221-3943 for escalations about eligibility, case management, benefits, PARs, you name it. Thank you.
Renee, I have a question.
Okay, Renee, go ahead.
Sorry, I'm getting things confused. Sorry. On that calculator, I need more information. What is that calculator that we're going to be using now that for CDOS?
Can take that one too, Kurt. And thanks, Renee. So the short version is that CDOS used to have the task worksheet, and IHSS had a very similar thing called the care plan calculator, and we moved to combine those. So it's one document that outlines all of the tasks in homemaker, personal care, and health maintenance. And it's very similar to what you're used to. It's just one new form with a new name. Does that help?
And where do I find it?
We've got it online. We can definitely mail it to you or email it to you if you prefer. Just let us know.
Email would be fine. Thanks.
I can email that to you too. I wrote it all down.
Thanks.
Thank you, Renee. All right. Any last things? I think if not, we are about ready to wrap up. Victoria, I see you have your hand raised. We got a little bit of time yet.
Sorry, I'm not purposefully trying to make myself obnoxious today. I did just have a parent text me and ask, there's some confusion on the appeal process. If you don't agree with something, there is a portion where it says that you have 10 days to appeal to continue to do your services until that is taken care of. But in a circumstance with the nurse assessor, she was told that you cannot appeal what comes back from the nurse assessor, that the 10-day rule for appeal is based on the CFC. Can someone clarify that for me?
Can take that one too. Thank you for the question. So the nurse assessor provides a recommendation. It's just that. So it's how many service hours for skilled care that a person needs. And then depending on what type of service the person's going to seek. So if it's CDAS, HMA, that'll go to the case manager for prior authorization. If it's a different method like home health or private duty nursing, there's a different process. I won't get into it here because this is participant directed programs, but if you have questions, there's information on our website. We'll put that in the chat. And then we've got an email address that you can email questions to if you have them.
Anything else, anyone? Any last words?
Renee has her hand up again.
Okay, Renee.
Oh no, I didn't have my hand up. Sorry if I accidentally pressed something that looks like it.
Okay.
Okay, no worries, no worries. All right. It's about 3:18. Great job, everyone, getting this done in our agenda time. Please realize we do have our next meeting scheduled in August. The fourth Wednesday of every month. It will be again at 1 o'clock. It will be a shorter meeting, hopefully, but we will really encourage any type of feedback or topics you want to add to that. You can still put them in the chat. My number is out there as well on the website, as well as Bobby's is, to add for any of topics you want to include. And with that, I'll just leave it open to anyone else who has any last comments before we call it a day and adjourn.
I want to remind everybody that I will take topic requests via email if that's easier.
Outstanding. All right. With that said, thank you, everyone. We'll give everyone a minute back. It's 3:19 on my clock. Let's call it a day, and everyone have a safe rest of the week and next month.
Thank you.
Thank you.
Bye, everyone.